Hey, it's Dr. Amanda with Straightsmile Solutions, straightsmilesolutions.com. I'm just going to give a quick update on my position as of 2025 on premolar extractions. And I know I've been making these YouTube videos for almost 8 years, so a lot of you are amazing followers. Thank you so much for following. And I appreciate you actually paying attention. Some of you have said, hey, back in these older videos, you were like, I would never take out teeth. And now all of a sudden you're saying, yeah, sometimes we have to take out teeth. And yeah, you're right. Maybe my position was a little bit strict 8 years ago, and sometimes my positions can change, as we progress in our career. So certainly like I've told you before, when I was trained in residency, our extraction rate was probably well over 50%. And definitely, I knew in my gut most of these were not needed. Once I started working, obviously sometimes I couldn't always, in the demographic I was working in, it was very difficult to get phase 1 patients. It was a lot of comprehensive, and by that time we were already like past the point of no return with growth and stuff. And there's no way these people, we would offer orthodontic surgery, but often that was definitely not an option, even with Medicaid and other stuff. So we'd try, but sometimes we'd have to pull out teeth, right? So that was our choice. Once I started getting more into different communities, I realized that I could do a lot of phase 1 treatment. And when I talk about not needing to take out teeth, I'm more talking about the phase 1 cases. Prove me wrong, but in a phase 1 case caught at the right time that does not have mile or habit issues, that does not have airway issues, prove me wrong. If you started it at the right time, not too late, and they're still growing, prove me wrong. I don't think, except for in a really strange one-off, you need to take out premolars on any of those cases. That's what I'm getting at. If you catch it early enough, you should not need to take out premolars. It should be fine. Taking out premolars is more what happens when you wait too long and we run out of options. So yes, and there's always other ways. Like, sure, you can do, an MSE or a MARPE or something. Okay, but we're not talking about that because I'm talking about non-surgical. That's surgical. Anytime you're screwing something in the bone, TADs, MARPEs, MSEs, that is surgical. We're talking about non-surgical. So there's only so many ways you can move teeth in a non-surgical way, right? So if you can't remember the 5 different ways we can move teeth, you should go watch my video on crowning. Just look up the keyword in my channel, crowning. It talks about the 5 different ways we can move teeth. So, in a patient that is totally done growing, we might not be able to expand the arch depending on the tissue biotype and how much bone. There's people that have a lot of bone in their jaws, width-wise, from anterior, posterior, transverse-wise, and it's going to be fine. We can definitely move teeth forward, procline them, or move them out transversely, and we can get space, and that's great. But some people we can't. They have thin tissue, thin bone phenotype. Cannot. That's why the CBCT feature in the Invisalign portal is so powerful, because you can really see right now what you can do. It does not accommodate for growth. It can't. How can it know how much the patient's going to grow? Nobody knows that. So you have to really look at the bone that's there, and that's where experience comes in. So hopefully this helps you guys. All right, thanks so much.